Time to go to the next question. Ankle brachial pressure index. What does this sound like? Ankle is in the leg and brachial is on top. So ankle brachial pressure index, some kind of a pressure difference between these two they are looking at. Okay, so you'll have to measure the BP here and compare. That's what it looks like. Let's see. Well, it is not the difference, it is the division, and ankle is on top. Okay, so you have to pay attention here, people. Ankle is on top, so the leg part is on top, right? And then you have the hand part here, that is the brachial blood pressure. So this is the ankle brachial pressure index. So using a sphygmomanometer, that is your BP measuring machine which you use, right? So basically here you will measure the systolic blood pressure. So we're looking only at the high value, and and look at this. So the ankle blood pressure systolic will be more. That's what they are saying. Okay. So the leg will be more and the hand will be little less. Okay. So that is why they're saying normally what will happen, if this is more, what will happen? The values are always above 1. Okay. Normal people, you, me, etc. The value will be more than 1. That means the ankle pressure is more. Correct. Now, what happens in people who have some vascular obstruction? We are talking about peripheral vascular disease. So what will happen here? There's less blood, let us say, because of some vascular obstruction they're saying, and here there is more blood. So what will happen? The pressure in the leg will be less. So that time this value will become less than 1. So that will indicate that there is some vascular obstruction. Less than 1 is bad. So we have put it in red, you can understand. Okay. If this ankle pressure, which is saying systolic, if it's less than 30 millimeter mercury, that means gangrene may be imminent. That means this tissue will go into death because it is not getting enough blood supply. Okay, so you'll have to probably immediately intervene, etc. What we are trying to say here is basically it indicates peripheral vascular disease. And in diabetic foot, what they are saying is in diabetic foot, this is ankle brachial pressure index is misleading because of calcified vessels which are incompressible. Okay. So that is another point to note. So here they are mostly focusing on the peripheral vascular disease. Okay. So what are the examples of peripheral vascular disease? Atherosclerosis, Buergers disease, all that. That is why they are asking you to measure. So here they are showing a TAO patient. TAO is just nothing but Buergers disease, right? And here you can see how there is gangrene, right? Ulcer. Is this an ulcer? Skin changed and ridged nails. So that is thromboangiitis obliterans, right? So it is usually seen in smokers, people who smoke, right? Their blood also will be hypercoagulable, please. And what are they talking about? So the small and medium sized vessels such as the dorsalis pedis artery, posterior tibial popliteal arteries, these are involved. They didn't say artery, they said the vessels are involved, so could be the veins also. Just write a word on the treatment. So you have non-surgical and surgical. So basically you want to relieve the pain with tablets. You want to have some positions where they will not have so much pain, right? Then you can have some vasodilators. They're not found useful, they're saying. Then we'll just not highlight this. Okay. No, wait, what they're saying is vasodilators are useful in TAO patients, but not in the atherosclerotic patient. Okay. So that is something then we will have to learn. The examples of the drugs are pentoxyphylline, right? Prostacyclin. Wow. So in the medical management, they're telling about aspirin. So it decreases the vascular death percent. You don't smoke, yeah. Don't have too much of lipid junk food. Then you can give them some antihypertensives. Okay. Anti-diabetic treatment. Okay. Vasodilator again. Then there is some sympathectomy which they are doing chemically or surgically. Okay. So what they are doing is lumbar sympathectomy. Okay. Why are they doing this? They are removing the nerve. So they want to remove this pain. So indication is pain. Rest pain. What is this? Omentoplasty. Omentoplasty has been tried. Okay. Omentum. Omentum is something to do with the abdomen, right? Greater omentum. Okay. So then you have the conservative amputation because if it's already gangrenous, what do you do, right? Then they're talking about below knee amputation, which is really, really rare.